The Model Systems Knowledge Translation Center presents Sexuality After Traumatic Brain Injury. This slideshow is based on research conducted by the Traumatic Brain Injury Model Systems and serves as a resource for individuals with traumatic brain injury and their supporters. The Model Systems Knowledge Translation Center is funded by the National Institute on Disability and Rehabilitation Research. This resource summarizes the research on the changes in sexual functioning that are common for survivors of traumatic brain injury. It also serves to help people with traumatic brain injury that are experiencing sexual problems as they work toward effectively functioning. How does traumatic brain injury affect sexual functioning? Traumatic brain injury can cause an increase or decrease in desire. When experiencing decreased desire, many people lose desire or interest in sex. When experiencing increased desire, many people find it difficult to control sexual behavior. In some instances, traumatic brain injury survivors may make inappropriate sexual comments or advances in inappropriate situations. Traumatic brain injury can cause decreased arousal. Many traumatic brain injury survivors may be interested in sex, but their body will not respond. Men may have trouble getting or keeping erect, and women may have decreased vaginal lubrication. In some cases, traumatic brain injury survivors experience an inability to reach an orgasm or are not physically satisfied after climax. Women that have suffered from a traumatic brain injury may experience reproductive changes such as irregular menstrual cycles and trouble with pregnancy. Men may have decreased sperm production, resulting in difficulty getting a woman pregnant. Some of the causes for the change in sexual functioning after traumatic brain injury are damage to the brain, hormonal changes, medication side effects, fatigue or tiredness, problems with movement, self-esteem problems, emotional changes, changes in relationships and social activities, and changes in thinking ability. What can be done to improve sexual functioning? Talking with someone may improve sexual functioning. For example, you might talk with a doctor, nurse practitioner, health or rehabilitation professional. Consider psychotherapy or counseling to help with emotional issues that affect sexual functioning. Consider marital or couples therapy in order to adjust to the stress level after a traumatic brain injury, or consider starting sex therapy to help you overcome sexual problems and improve sexual functioning. Another thing that can be done to improve sexual functioning is to make arrangements in advance about issues that are conducive to sexual intercourse. Get a comprehensive medical exam to check hormone levels and any roles your medication may play in irregular sexual functioning. Talk with your partner to plan sexual activities when you are less tired and most likely to perform best. Situate yourself during sex in the most comfortable position and arrange things around you so you will be less distracted during intercourse. You can also prepare in advance for sexual functioning by watching movies or reading books or magazines with erotic images and other sexual content, or looking into getting sexual aids developed to help people with disabilities. It is very important, both before and after a traumatic brain injury, to protect yourself from unplanned pregnancy as well as sexually transmitted diseases. Tips to help protect yourself. Research and figure out methods of birth control and protection that fit you best. Also, Inform and familiarize yourself with the different options. You can also plan for sexual intercourse by always keeping a method of protection for you or your partner. For women using birth control, developing a method to help you to remember to take medication or change device. Getting tested and treated if you test positive for sexually transmitted diseases. More information can be provided to you by consulting with a physician, talking with a traumatic brain injury staff member, and researching other resources. For additional resources on living with a traumatic brain injury, please visit the Model Systems Knowledge Translation Center website at www.msktc.org.